Hello and welcome. This is the World Economic Forum in Geneva. We're hosting the World Health Organization's Africa Media Briefing. My name is Adrian Monk.
Et je suis Peter Vanham pour les écouteurs français qui nous rejoignent, francophones.
We're going to start the briefing today by going to Brazzaville and to the regional director of the World Health Organization, who'll be familiar now to many of you, Dr. Matshidiso Moeti. Dr. Moeti, can you give us the latest from your perspective on how the pandemic is progressing in Africa and how responses are progressing?
Thank you very much, Adrian, and good afternoon to everybody. And thank you again for having joined us. I'm very pleased to be joined today by colleagues from the Economic Commission for Africa, Dr. Karingi, and my good friend Amit Thakker, who's the executive chairman of the Africa Health Business, because we know that the COVID-19 pandemic is having significant economic impacts, and particularly in vulnerable communities. We need balanced action to save lives and livelihoods, even as we act to control the pandemic. The private sector has a vital role to play, from providing care to those who are affected, to manufacturing the key items required for the response, as well as innovating and developing new tools like vaccines and medicines. There are now more than 51,000 confirmed cases, and 2,000 people have lost their lives across the African continent. We're very concerned that almost 1,000 African health workers have been infected with COVID-19. We know that most African countries already have a severe shortage of healthcare workers. And when our frontline workers fall ill or are absent from work, communities don't have access to essential services like immunization, safe deliveries, and treatment for chronic and infectious diseases, in addition, of course, to what impact these shortages will have on our ability to respond to the COVID-19 pandemic. Due to global shortages of personal protective equipment, our frontline health workers and other frontline workers remain at increased risk of infection. We're working with countries and partners to replenish supplies so that healthcare workers can safely continue to provide these routine services that I've mentioned. As the pandemic evolves, it's incredibly important that countries use data-driven and evidence-based approaches. We've modeled the implications of widespread community transmission in each country in the African region based on country-specific social, environmental characteristics, and people's vulnerabilities to COVID-19. The results predict a high risk of exposure in geographically smaller countries and in countries where people are able to move around easily, as we've seen some of the larger countries like Algeria and South Africa and even Cameroon be severely affected. Among the 1 billion people in the African region, the model predicts that if no containment measures are put in place, and luckily we know that this is not the case even up to now, up to 26% of the population could be infected in the first year, and up to 190,000 people could die. The epidemic would peak within 4 weeks of the start of widespread community transmission, and we know that in about half of the African countries, we do not yet have widespread transmission. This would overwhelm health systems, leading to more than 3 million COVID-19 hospitalizations, of which around 100,000 would require oxygen support and more than 50,000 would require support to breathe. It also leads to reduced access to routine health services, which I've mentioned are extremely important to be sustained so that communities are not vulnerable to other health issues. All countries in the region are using these results through our country offices to inform containment actions, and a paper summarizing these models is currently in press in the British Medical Journal Global Health after extensive peer review. I have to say here that there is a range of modeling tools that are being used, and WHO is working with partners to set up a coalition so that we share the methodologies and have rather consistent advice to countries on this. We know that to stop the spread of the virus, the key public health measures need to be in place in every community, even where cases have not been reported. Readiness capacities should be prepositions. I'd like to reiterate that these measures are surveillance, identifying cases early, testing people early, therefore, tracing their contacts, and then isolating both the cases and the contacts to limit spread of the virus. We've seen countries like Namibia and Seychelles follow closely these measures, and they've not reported any cases now for 1 month. We're working with countries to leverage the assets that they already have in place in terms of what was done to prepare for Ebola, some of the equipment for testing that's being used for tuberculosis and polio, and to mobilize people and repair supply chains globally. We're working very hard on this with our colleagues across the UN and other partners, so that the supplies that are needed are there to take the response beyond capital cities into the hinterland and local levels. The findings that I've shared today and other emerging analyses will inform our policy and technical advice to governments so that they adopt the response based on this evidence. To stop this pandemic, the solutions we implement together with countries and partners must be based on evidence and scientific findings. And therefore, this includes conducting rigorous clinical trials to determine the effectiveness on any treatments that are offered in line with international standards. We are very convinced that with science and solidarity, we can stop this pandemic. Thank you very much.
Dr. Moeti, thank you very much. And you mentioned a couple of the guests who are joining today. One of them is Dr. Amit Thakker, joining from Nairobi, who is president of the Africa Healthcare Federation and also executive chairman of Africa Health Business. Business obviously has a big role to play in helping tackle this pandemic, but is also affected by it. Can you give us some insight, Dr. Thakker, on how business across Africa has been coping with this crisis?
Yeah, good afternoon and good morning, wherever you're joining from. Thank you for having me on the show. And like you rightly say, that the sudden shock that the businesses have faced because of the pandemic has really made the business start repurposing and repositioning itself. It's led to two things. One is the business is now pretty aware of the economic collapse and what we've seen in the reduction of GDP in many countries across Europe and also USA. And some countries in Africa are already projecting from the 5 and 6% growth to going down to 1. And South Africa has also been projected to have a negative growth rate. So the businesses are very aware that because of the reduced mobility and the stringency that the African nations have to adopt because of public health, it's going to have an interplay. Now, moving quickly on to the repositioning and refashioning of what the businesses have started doing is the model of self-sufficiency. So many manufacturers who never made PPEs are now making PPEs. Close to 42 factories, for example, in Kenya, have already put up machinery, cleaned up their machines, realigned them. Masks are being made, overall gowns are being made. Those companies that never got in making sanitizers, like the East African Breweries Limited, are making sanitizers to spread them around. So that's happening now. And on the front line, the people who are providing services are really concerned, especially the private sector. I know many countries and many public sector economic stimuluses and ministries of health are trying to support them, but the smaller private sector hospitals and facilities are concerned because they need to charge fees for services being rendered. And if they buy these PPEs at $30, $50, it's charged to the patient. And there was a lot of negotiation with the private insurance company and the national insurance companies to keep paying the bills for those who might be COVID positive. So that's again a matter of concern for us on financial sustainability, coupled with the fact that most of the people are staying at home. They have postponed elective surgeries and they've postponed their regular medical treatment and admissions. So the surgical cases have dropped in the range of about 40 to 50% of the income, and the medical cases have dropped between 30 to 40%. And that's led to a decline in the revenues for the private sector facilities in the front line. So we quickly need to start thinking of how to make sure they wade through this process. Thank you.
Dr. Thakker, thank you very much. We can go to Addis Ababa now and to Stephen Karingi from the UN Economic Commission for Africa. Stephen, can you give us some perspective on how the pandemic is hitting things like trade across the continent, and also how it's more broadly affecting societies and their economies?
No, thank you very much. Let me first of all acknowledge my co-panelists, Moeti and Dr. Thakker. And first, to make the first point is that we have to recognize that African governments are doing a lot. And I think that is what Moeti has indicated, that the projections were that we are going to be in a worse situation by now, but because of the measures that the African governments are taking, and also the community's effort, we have at least been able to see not as much rapid growth or exponential growth in terms of transmission like we saw elsewhere. But then, of course, this has come with an impact on our economies. So we have heard what Thakker has said, what is happening to the private sector. But there is this trade channel and the FDI channel, the connectivity between Africa and the rest of the world. And so what has happened is that there is actually suppressed demand on most of the trade that takes place between Africa and the rest of the world. So we have a situation whereby when it comes to textile industries, even though they are repurposing, they are not able to operate at full capacity, to utilize their full capacity, because before they were producing for European markets that are currently not open. When it comes to some of our agricultural products, coffee, horticulture, these are things that are also being affected by the inability of the airlines to leave the continent or to go and land in other continents. So there is that trade channel that is having a big impact on our economies. In fact, our estimation is that we are going to witness at least 2.6% contraction of the African GDP because of these measures that are currently being undertaken, both within here in Africa and the rest of the world, whereby they are affecting on the trade between and also the investment flows between Africa and the rest of the world. At the community level, we have just come out of a debate where we were just debating as a continent on the question of the lockdowns and the exit. And one of the figures, some of the numbers that were coming out there were that since 60% of the African population lives in informal settlements, it is becoming very difficult for them to be able to keep to the lockdowns because they need food. They wake up in the morning, go and look for money for the food, and come back, eat their food. Then the next day they go and look for their second meal. So there is a statistic that shows that at least 70% of these people in these urban settlements have actually reported that they have seen an increase in the price of the food that they need to sustain their lives. But much more importantly, 87% of them say that they are either skipping a meal or even eating less. So there is this social implication to the population of the measures being taken, which of course we need them so that we can suppress the transmission of the virus. And this is the point that I would want to conclude my initial statement by saying this is why we need this global solidarity. I think the WHO is doing a great job in coordinating all of us and also being able to categorize the support towards how to deal with the health dimension of this effort. But since governments are also spending a lot of money, as ECA, we support the big call for the fiscal stimulus by the African government. We support the call for the debt standstill for at least 2 years so that African governments can be able to not only deal with the social dimension of the implications of the pandemic, but also to keep the businesses open, because we also want to make sure that after the pandemic is brought under control, there will be businesses to go back to, and that there will be people who are still working, because you cannot have a recovery if you do not have businesses and if you do not have people having jobs. Thank you very much.
Thank you very much. We've got a lot of questions on this afternoon's call. I'm going to turn first to the news agency of Nigeria and Oluwafunke Ishola. Can I just get your audio up and get your question?
Okay, good afternoon.
Good afternoon.
Yeah, some African countries, they've actually started easing the lockdown of the pandemic. What's the assessment of WHO on these countries, and what measures do you think countries can actually put in place to ensure that the numbers of cases recorded does not increase during this ease?
Yes, I think, the preceding discussion really highlighted the need to keep the balance between the lockdown measures to control and the economic impact, and releasing these measures in a progressive way based on data and on certain conditions, if you like, is very important. First of all, there should be a documented decrease in the rate of transmission, in the number of cases. So the transmission should be being reduced. And then secondly, it should be that the public health capacity to put in place those measures, case identification, isolation, contact tracing, should be in place at all levels. This means beyond the capital city to where the virus might potentially spread. And it really suggests decentralizing these capacities by governments in countries with the support of partners. And it also is very important that risks should be minimized in those places where social gatherings happen. So I think it's not a matter of simply today we're locked down and tomorrow everything is opened up. It has to be progressive. It has to be starting with the most vital components of the economy, because that's part of the reason, and also taking into account these difficulties around food and hunger of the most vulnerable communities. It has to be with tracking what's going on in terms of the cases that are coming out, the capacities, and then with support, with putting in place measures to make sure that then what is left in place is monitored. And if necessary, if there is the need to go back and reinstitute some of the measures, it's possible to do this. And then most importantly, people have to be very well informed about the impact and be enabled to follow and to provide feedback about the impact on them. So it's possible to do this. We're advising countries. We have a guideline from WHO on how to progressively release these measures.
Thanks for that. Dr. Thakker, can I just turn to you and ask how business sees that relaxation and the process of easing some of the lockdown?
I think Dr. Moeti framed it really well. I totally agree on the evidence-based approach. But there are two schools of thought from business. One is there is this sense of urgency from business to start opening because they seem to be losing some economy. And also the cost and the prioritization. So I think the first thing I would say is the trust from the governments on data and on evidence-based, on why it's being locked down and what is being unlocked and why certain businesses and not the others. The other thing, like in Kenya, the restaurants which are being asked to open progressively need to make sure that everybody has got a COVID test and they are COVID free. So there have been flags raised about the fact that we already have reduced income, and now we have to expense these costs, which will make it a bit more expensive. So there's a literal balance between there's a sense of urgency of can we open up, and having clear data of why things are not opening up in countries like Kenya.
And Stephen, you mentioned some of the problems that people have in the informal sector of actually just getting hold of the necessities of life. How do you see this lockdown easing proceeding from your perspective?
Well, that's a great question, because in our call, we had somebody who worked with the informal settlements in Nairobi, someone from Kibera. And essentially, he was saying, okay, I do understand that I need to wear a mask, but I don't even have the dollar to buy the food in the first place. But as we went with the debate, there was clear consensus that nobody wants people to die. So what we need is to actually have smart exit strategies from the lockdown. And it looked like we were concluding to the point, make sure that what Moeti has said, that the rate of increase of the infection and the number of people who are infected in the total number of the tests that you do in a day are falling. And once you realize that, then you can also do it sequentially by looking at which sector is not as risky, opening that fast, and also maybe in some situation having to do it block by block, because that's the only way you can be able to ensure that you don't have to shut down the economy again. But I would also want to note that there was a story that I have seen whereby, in Africa, we have this community approach to doing a lot of things. So we have households of people who have more money, who are actually adopting households who are living in who do not have as much money. So I think stories like this needs to be emphasized and put on a loudspeaker so that we can actually have more community-based support. Of course, we have to figure out the logistics of how to move from those who can support to those who need the support.
Thanks, Stephen. I want to turn to Simon Allison from the Mail and Guardian in South Africa. Simon, can you come up, unmute, and get your question in?
Hi, good afternoon. My question is for Dr. Moeti. I noticed that the so-called coronavirus cure being touted by the Madagascan president seems to be gaining traction. What advice would you have to citizens of countries who are considering taking this supposed cure? Thank you.
Dr. Moeti.
Okay, thank you. We are advising the government of Madagascar to take this product through a clinical trial and are prepared to collaborate with them. We've also invited them to join the WHO coordinated solidarity trial where other therapeutics are being tested out. So we would caution and advise against countries adopting a product which has not been taken through tests to see its efficacy against COVID-19 and also its safety in different population subgroups in use against COVID-19, and simply encourage that anything that is being used should be done under conditions of clinical trial where the evidence can be collected and it can be assured that it is not a risk to people's health. In addition, just to emphasize that all the measures for protection that are being promoted by WHO need to be implemented, and we are concerned that touting this product as a preventive measure might then make people feel it's safe not to do the other things. So we'd like to emphasize very much that whatever is being done with this product, people must continue to put in to implement the measures for protecting themselves.
Thank you very much. I'm just checking to see if we have on the line Cara Anna from the Associated Press. Can we just check if we have Cara available to go to for a question?
Hi, I'm here.
Great. Cara, can you put your question to our panel?
Yes, thanks. Have you seen any clusters of virus cases that appear to be linked to lack of water or lack of clean water or to a communal water source? Thanks.
Thank you. Dr. Moeti, and perhaps Dr. Yao might come in on that.
I think not explicitly and not directly, but of course we can infer that one of, water is an absolutely essential commodity for basic healthcare provision. So in health facilities, there might be a risk if there is not access to clean water. Then in terms of the hygiene that can be practiced, including by the healthcare workers in hospitals. And we're of course very concerned in some of the settings in Africa where at home people may not have and do not have access to safe water, about the feasibility of their being able to practice this hand washing hygiene. That's why we're encouraging countries to work with some of our partners who do water and sanitation development like UNICEF to put in place then public facilities where people can have their hand washing needs somewhat addressed.
Merci beaucoup, Dr Moeti. Et on va voir maintenant si on peut rejoindre Roger Mogo de Canal+ Afrique. Roger, êtes-vous là?
Je voulais poser une question justement concernant le déconfinement qu'on voit de plus en plus dans certains pays en Afrique. Et ceci d'autant plus que le nombre de nouveaux cas de Covid-19 est en cours d'augmentation, ce qui pourrait laisser penser que le pic n'est pas encore atteint. Et la question est de savoir si c'est vraiment pertinent de déconfiner actuellement, si c'est pas très tôt. Et si c'est le cas, alors est-ce qu'il fallait vraiment confiner les gens?
Merci beaucoup, Roger. On avait déjà entendu une question pareille en anglais, donc on va peut-être demander à Dr Yao de répéter ce qu'on a entendu avant et de nous dire comment des pays peuvent commencer à faire une sortie du confinement de manière sécurisée.
Merci beaucoup. Nous pensons que le déconfinement, parfois lié au fait qu'il y a une bonne partie de la population qui est en souffrance, aussi bien des domaines économiques qui souffrent énormément. Et donc, ce déconfinement doit vraiment tenir compte aussi de la reprise de ces secteurs, mais surtout être basé sur une analyse avec des évidences qui montrent la tendance globale, si cette tendance globale peut permettre ce déconfinement plutôt que peut-être entraîner l'aggravation de la situation. L'autre aspect qu'il faut tenir compte, c'est qu'il faut s'assurer qu'on ait la capacité de détecter, de confirmer et aussi de prendre en charge des personnes qu'on pourrait détecter. Et cette capacité, on doit s'assurer que cette capacité est décentralisée et puisse permettre de mener cette activité de contrôle qui est essentielle partout dans le pays. Il faut aussi s'assurer qu'on ait aussi une bonne compréhension des facteurs de risque. Qu'est-ce qui entraîne la propagation de la maladie? Est-ce qu'il y a des points chauds qu'on appelle communément des hotspots à partir desquels la maladie se propage? Et alors, qu'est-ce qui s'impose? Et donc, un mécanisme qui permette une surveillance continue et qui peut recommander éventuellement un retour en arrière si cela s'impose. Mais la capacité de détection, de contrôle et de prise en charge est nécessaire avec un mécanisme d'analyse continue.
Merci, Dr Yao.
Thanks very much. Turning to Kenya and to Ochieng Ogodo of SciDev.net, we have a question from him. Can we bring you up?
Thank you. Good afternoon, everybody. My question goes directly to Dr. Moeti, and it's a very short question. Dr. Moeti, how do you see Africa in post-COVID-19? Do you see a continent devastated, or do you see a continent rising bravely and brilliantly out of that this pandemic? Thank you.
Thank you. What a brilliantly challenging question. You know, I don't want to ignore the severity of the situation, and we have some projections which I've already mentioned. If nothing effective is being done, then the situation could be very serious for Africa. We've already heard that the economic impact is going to be there already from the situation currently, and that obviously will need a lot of effort on the parts of the government, of the population, the private sector, and international solidarity in order to recover. I see that countries are making a lot of effort to invest in overcoming the situation. So I'm hoping that we will not have an absolute devastation. There will certainly be negative impact. And I am very encouraged by the global solidarity that is already being expressed towards Africa, the debt, if you like, the debt freezing, the debt repayment freezing that's already been announced. I'm expecting very much that Africa's partners will also provide additional other support. And my observation, you know, when we came out of that devastating Ebola outbreak, it left in those countries some determination to start up better. And we have seen how Liberia, Sierra Leone, for example, have been able to put in place measures to confront the epidemic that have been quite impressive. That painful learning really enabled them to start off at a different level with a different outlook on how to invest. So my expectation and hope is that this will happen more broadly in African countries after the difficulties that we are going to be seeing. I have a lot of faith in the resilience of African people, their ingenuity, and I hope combined with the determination of governments and with international solidarity, we will not see a continent flattened and in despair. It'll be difficult, but people will put in their best, and we'll make sure that we recover both in health, economically, and very much at the level of vulnerable households on the continent.
Perhaps I can bring in on that Stephen and Dr. Thakker. Dr. Thakker, maybe I can just bring you in on that from your vantage point in Nairobi.
Thank you, Ocheng, and that's a really nice question, and Moeti has answered it pretty well. I think there are three phases post-COVID for Africa. It's the 2021, 2022, and 2023. It's phase 1, 2, and 3. The current phase of combat requires all hands on deck, and we've got WHO, all the partners, private sector, public sector. It's what we do in the combat phase that will actually guide us on phase 1, 2, and 3 of recovery. Phase 1 will be repair, literally catching all the tatters. We'll be hoping for a vaccine to come. We'll be providing vaccine to everybody. Economies will start opening. Social distancing will still be the order of the day. Protecting and hand washing will still be the order of the day, but there'll be some repair. The second phase of 2022 is where Africa will be counted, whether we'll come out to be stronger and actually a great continent that will see a rise, or we might have a delayed decline. The second phase is the phase of partnership and leadership. I think we'll start separating the leaders who believe on progressive growth, just like we're talking about progressive unlocking. We'll see progressive leadership that will start encouraging partnerships globally to invest more and to make Africa the hub of products and services that we've already started seeing so much progress. And then the third phase will be the rise phase, and that can take about 3 to 5 years. And I believe, and I'm optimistic, that we'll actually have a stronger continent post-COVID.
Thanks for that. Stephen, you're in Ethiopia, which was one of the strongest economies in Africa until the crisis hit. What's your perspective on how this pandemic is going to hit the continent?
Thank you. I think this is a brilliant question because, yes, it's true we are talking about where we are now, but we also have to think about recovery. And I want to go back to the point that I made. The speed at which we recover will depend on the actions that we take today to save lives and to save businesses. Because without businesses, you cannot have employees. And without employees, you cannot have income. Now, how do you do that? The resources that we are calling for in terms of this global solidarity, the $100 billion that is being called for. Part of that should go towards ensuring that there is liquidity for the private sector to be able to work, and also it should also go towards replenishing some of the expenditures of governments for those that are actually doing transfers to the vulnerable, and even those that are topping on in terms of the wages of the people. So our ability to recover as a continent will depend on what we do today. Do I think we are going to have a better economy after this? We have the continental frameworks. I think we have been exposed very much in terms of the area of trade because we did not actually have our African continental free trade area in operation. Had it been in operation 10 years ago, I am of the view that a lot of the things that we cannot access because of export restrictions, most of that could actually be produced here, and the movement across borders would be much, much easier. So going forward, I believe the African governments, the people, they are going to demand that we accelerate the momentum within which we build on our continental frameworks, be it the pharmaceutical manufacturing plan for Africa, be it the African Continental Free Trade Area. And this way, we are going to end up with a stronger economy. And it builds into this question of partnership and leadership that Thakker has mentioned.
Yep. We want to go to Shea Bopu from NHK, Japan's national broadcaster. Can we ask you for your question, please?
I would like to hear about the projected peak of the cases in Africa. In South Africa, when I'm currently based, the government and the experts think that the peak in this country will come sometime between July and September. Do you have a similar kind of projection for the continent as a whole? Thank you.
Before taking that question, can we also just bring in another journalist from South Africa, Tim Cohen from the Daily Maverick, and just get his question too?
Hi, Dr. Moeti. Not the most important question, I guess, but it's still very controversial here in South Africa. South Africa has been unusual globally because it's imposed a cigarette and tobacco ban, or a ban on tobacco and cigarette sales. It's the people are reporting here that the World Health Organization supports this ban. I just wondered, it seems now that smoking does, ironically, weirdly, help the convalescence rate, not the infection rate, but the convalescence rate. I just wondered whether you, if you support a smoking ban, would you recommend, or a smoking sales ban, would you recommend that to other African countries? And
that's a great question.
What precisely are you advising African countries? Are you suggesting a restriction or a ban?
That's a great question, Tim. Thank you. And so we have questions from NHK and from the Daily Maverick. Dr. Moeti, just over to you for those two questions, and maybe to bring in Dr. Yao if necessary.
Okay. Yes, thank you very much. As I mentioned, we have carried out a modeling exercise, which we're just publishing now, on overall in the African region, WHO African region, and also have made this available to our colleagues at the country level, and they're going on to do this on a country level basis. Overall, looking at the evolution of the pandemic, and especially now we're in the phase of community spread in some African countries, we are estimating that, and this is an estimate based on if nothing much was done, we are estimating that this would peak in about 4 to 6 weeks in African countries. So this is a model that takes into account many factors, many components, including population movement in countries, population density in countries, the prevalence of some of the underlying illnesses that would be a factor, the age structure of the population, etc. So we have estimated using this model that it would take about 4 to 6 weeks from the start of community spread in a country for this to peak. And we know that, as I mentioned before, we have a number of countries where this community spread is established. I think it's about a third of our countries in the African region. And then we have another third where there is clusters, not yet widespread community transmission. And then there are others where they've managed to control even the clusters. And we've had only imported cases so far. The matter of tobacco, WHO recognized the risk of smoking to what is we have understood, and what is actually an infection, a respiratory infection, and our support for the idea of then limiting that added risk of smoking when people have a respiratory infection was in that sense. I'm not aware of this data that you are indicating shows that there is some sort of support to early recovery if people are smokers. We will need to look into this and see what it is that we would advise countries on. We were not particularly focused on this as a risk, but I think when a country has identified this as a risk, we could only say, well, we support then the minimizing additional risk of people, not only those who have underlying conditions, including conditions perhaps like asthma, but people who might then be aggravating the risk by smoking, something that we know is bad for your respiratory health as well as other health conditions, that we can only encourage that people who can stop using such a product.
Thanks for that. Yeah, pretty remarkable to see people pointing to something that we know kills you as offering any kind of protection. Can we turn, please, to Paul Adepoju at the Lancet in Nigeria? Paul.
Yeah, thank you very much. My first question is there an official estimate of how much Africa has lost to the COVID-19 pandemic? Then looking at post-COVID-19, we've had African countries that are locally producing their masks. Are there any plans to directly and actively integrate them into the health supply chain post-COVID-19? Thank you.
Thanks for that. And maybe the slant of that question, I can take it to our guests first, and then maybe come back to Dr. Moeti at the end. And Stephen, maybe to start with you, is there anyone you know of who's keeping track of the potential losses across the continent caused by this pandemic?
Yes, thank you. So far, I said in my earlier statement that we have done some scenarios. One of our scenarios suggests that the African economy will contract by as much as 3% in 2020. Now, when we're doing this study on the strategies for exits from the lockdowns, we also did a simulation where we assumed a full lockdown. And what we found out is that every month, the African economy would lose 2.5% of its GDP. That is something equivalent to about $65 billion every month. So based on the intensity and the strictness of the lockdowns, if you have a full lockdown of the whole continent, you would lose about $65 billion. So of course we can do this for each of the countries based on the different lockdowns structures that we have. But that is one way we have factored down to estimate what it means for the continent. We have finished the first quarter, so governments are starting to release their statistics. And one of the statistics that is coming out clearly is that there is a reduction in terms of the export earnings, as you would expect, and also the revenues, the revenue take by governments. Because of the low activity of the businesses, they're also starting to collect lower revenues, which is an indication of what is happening in the economy.
Thanks for that. And Dr. Thakker, from your contacts with the world of business across the continent, is that something anecdotally that you're seeing backed up, or are there perhaps any bright spots that you can point us to?
I think Stephen's put it very well, and the contraction is going to be, it's like just the numbers that we have. It can be worse. Like Moeti says, if we start opening up and we don't control containment, it could be a larger contraction. But there are some winners and losers as well. And we are going to see that happening very clearly in Africa. And if you look at the tourism and the travel and industries around them, they're definitely going to get a stronger hit. But probably there are some winners, like maybe the healthcare industry might be a winner and they might recover well. If you look at the stock exchange, there are some industries that have taken a less of a hit. For example, if you look at the telecoms and the IT and the mobile phone companies, they've taken a less of a hit in the stock exchange than maybe other companies like Kenya Airways and airline companies. There are also companies like infrastructure, those who provide cement, and maybe the media company. So those are in the middle bucket. They will find the way through and they won't have a significant hit. but we will soon see in sub-Saharan Africa them being separated according to how they adapt, how they use technology, what kind of value offering they provide. So my really call out and the shout out to the boards of every company in Africa is start having a strategic intent on how you can retain jobs, how you repurpose your business, and it's not business as usual, out of the box thinking, and that will reduce the contraction that Stephen's been talking about.
And Dr. Moeti, obviously the World Health Organization concentrates on health issues, but it's also dependent too on people having livelihoods and a way of looking after themselves. So what's the WHO's kind of perspective looking at the crisis unfold economically?
Oh, well, yes, we are also we're very concerned about the unfolding economic crisis from several perspectives. First of all, the impact on vulnerable households, which are most severely hit because they are the most vulnerable to ill health. And we do not yet have on the continent the kind of health financing strategies that make access to health services equitable. So it's going to just worsen the situation of people who are already somewhat disadvantaged in getting access to basic health services. This is a very big concern for us. And then over and above that, we are concerned about the impact that this will have on the ability of African countries to make progress towards universal health coverage. They have made, in the recent past, before the advent of this pandemic, very ambitious commitments to expanding access to essential health services for their population with a strong view on equity, increasing their financing for health in ways that are fairer for populations. So this hit in economic performance, we hope will not result in the health sector, which is sometimes viewed as a kind of soft sector, not a productive sector, than to be disadvantaged in terms of investment. We hope the governments have understood very well that investing in health is a smart investment in human capital, and it's essential for economic development to progress. But these are some of the concerns that we would have. On the other hand, just coming to some of the comments, the comment made by Amit about driving adaptation and local production. We are very hopeful that some of the work and thinking that has been done under the auspices of the African Union and NEPAD with regard to health as part of the industrialization framework of the African Union can be taken forward for the production of some of the supplies that are needed for health to be done on the African continent. Of course, we'll need to look at affordability and economies of scale, but that we can accelerate some of these initiatives that have been moving along at a rather steady and sometimes slow pace for self-sufficiency while we work within a globalized global economy.
Thank you. Merci, Dr. Moeti. On veut aussi poser cette question ou ces questions en français. Tout d'abord, peut-être Dr. Yao, pouvez-vous donner votre commentaire sur la question quand est-ce que vous attendez au pic des cas en Afrique, dans le continent? Et deuxièmement aussi, comment voyez-vous la situation évoluer après, non seulement sur non seulement en santé publique, mais aussi du point de vue économique, et quel est le rôle que l'OMS peut jouer à ce moment-là? Merci, Dr. Yao, de donner votre commentaire.
Merci beaucoup. Donc, par rapport aux projections dont a fait référence la directrice, lorsqu'on a une transmission communautaire, on s'attend à ce que d'ici les 4 à 6 semaines, qu'on puisse atteindre les pics. Il faut aussi dire que cette situation est variable d'un pays à un autre. On a pratiquement le tiers des pays africains qui ont cette transmission soutenue au niveau de la communauté. Mais la modélisation ne tient compte du fait que si rien n'est fait, voici la situation qu'on pourrait atteindre et qui pourrait peut-être même être une situation beaucoup plus aggravée. Et il faut ajouter qu'en Afrique, on a encore l'opportunité, même en dehors des grandes villes et dans certains pays de contenir. Et donc, si les efforts sont renforcés, cela pourrait se faire dans plusieurs pays en termes de réduction de la transmission. En ce qui concerne les aspects économiques, évidemment, l'accès aux services est souvent lié aussi à certains aspects économiques, notamment au fait d'avoir des revenus pour pouvoir s'offrir des services de santé, au fait aussi pour les pays d'avoir la capacité de renforcer les services de santé. Et donc, un effondrement économique pourrait un peu ralentir l'accès à ces services de base. On parle souvent de la vaccination, mais aussi des interventions liées à des programmes comme le paludisme qui pourraient souffrir aussi d'aspects économiques défavorables. Et donc, c'est une approche globale qu'il faut, en plus des aspects de santé publique dans cette épidémie de Covid. Merci.
Très bien, merci beaucoup, Dr. Yao.
Thank you very much. And just want to turn to Esther Nakazi. Esther, can we get your question, please, to our panel?
Thank you very much. Can you hear me?
Yep.
Yeah, my name is Esther Nakazi. I'm a freelance journalist based in Uganda. I would like to know from WHO what their position is on Tanzania president's remarks on the COVID-19 tests that were done by scientists, and what is their position on scientists, on leaders who are not agreeing with the stats coming in from the scientists.
Okay, Esther, thank you for that question. Dr. Moeti, can I turn to you on that? How do you deal with potential issues with leaders and scientific pronouncements?
Yes, thank you for that question. I think starting with the specifics of the test kits referenced in Tanzania, we are convinced that the tests that have been provided and that are on the international market were provided both on procurement through WHO, those that came through the JECMA donations are not contaminated with the virus. I'm afraid we do not share the point of view that these commodities could be in circulation when they're already contaminated with the virus. We are not in agreement with that point of view. We encourage leaders to look at the evidence and also to look at guidance that has been developed by experts of the organization of which they are member states, expecting us to find the best experts in the world in order to find the best ways for countries to use knowledge, science, evidence for the interventions that we're asking them to undertake. We are very happy through our country teams working with partners to enter into a dialogue and respond to questions and queries by national leaders. We are also very pleased to share with them evidence of the impact that has been seen in other countries that have undertaken some of these measures, including such measures as stopping large social gatherings. You know, we have experience in some of the Asian countries where there has been success or progress in containing this outbreak. We have made it very clear to the government of Tanzania that we are ready to have a dialogue with them. Our country team is available on a permanent basis together with partners to enter into this dialogue and hope that we can start to see an evolution in the number of cases in the country, which is a great concern now in East Africa, including among some of the mobile populations, truck drivers who have crossed from Tanzania into other countries and have been discovered in those countries to be carriers of the virus. So we are very open to a dialogue. All our knowledge is at the disposal of the government, as is our technical capacity to support interventions that we are advising should be put in place in the country.
Thank you very much. Last 5 minutes of today's briefing, but we have a few questions from colleagues in the international media. From Jason Burke of The Guardian, Johannesburg. Do current totals of cases reflect the true spread of COVID-19 in Africa? And if not, why? from Peter Thornycroft of The Telegraph. Are some countries like Lesotho unable to afford tests because they're too expensive? An issue about the expense of tests there. And from Ruth McLean of the New York Times, what will the impact of COVID be on treatment of malaria, HIV, and cancer in Africa? So perhaps if those three questions can be drawn together, Dr. Moeti, just for a final wrap up from you, and perhaps Dr. Yao.
Thank you very much. The number that we have in most of the countries are related to a number of cases that has been laboratory confirmed, but we also know that this disease has an asymptomatic component that is difficult to capture regardless the country having or not testing capacity, but it's at least help to have a clear idea of the trend in terms of transmission in a given country or area, and it helps also to reinforce the public health measures. About the testing, in most of the countries, the testing are free. It's provided through support from WHO or any other partners. The main concern has been availability of this testing test equipment as well as reagents on the international market to make them available to countries. So this has been the main challenge. I know that in some of the countries, the private labs are also involved in, but it's largely free. The problem remaining the quantity to make it available and to effectively contribute to the detection of cases and the appropriate public health measure. In terms of other disease, it has been mentioned 2 weeks ago in this similar forum that putting all the effort to contain COVID should not affect also access to other services. It is unfortunately occurring, and it is a big concern for us. We need to ensure that we have appropriate reorganization of our services so that on one side you can have COVID management, but on the other side, we ensure continuity of services, including critical services in Africa, like vaccination or access to treatment for malaria and HIV/AIDS. And we have good example in countries like South Africa, where specific effort has been put in place for people to continue to have access to HIV/AIDS treatment. So this is what needs to be done. It's a long run, and countries should ensure that they maintain this continuity of services while dealing with COVID. Thank you.
Thank you very much. We're almost out of time on today's briefing. Perhaps a final reflection, Dr. Moeti, on the week ahead. What's on your schedule as you look forward to the coming week?
Yes, thank you. And I'm very sorry, we had a technical problem and we lost contact for a while. I think we're now at the point very much where countries that had put in place these measures are contemplating relaxing the measures in a progressive way. So we're very much in touch with our teams at the country level, helping to advise, as we said, the progressive evidence-based way that these measures are being implemented. We're also looking at some of the evidence that's emerging about the case management and looking at adjusting what we're advising countries based on information that's coming out, for example, about some manifestations, microembolism, meaning that we need to be careful about the treatment and advise on perhaps modifying slightly the case management. And then finally, I'd just like to return for a moment to the question of therapeutics, particularly the Madagascar medicine or traditional medicine, and just remind everybody, including African governments, that, you know, our governments in the year 2000 committed through their ministers of health that they would treat traditional therapies in the same way as other medications by taking them through these trials. So I would like to leave here a plea and advice that this resolution decisions of the governments needs to be followed. This is a time of challenge. We understand the need, the drive to find something that can help, but we'd very much like to encourage this scientific process on which the governments themselves made the commitment in the year 2000 through their ministers of health with WHO. Thank you very much, and I look forward to a productive week working with all our partners to support countries.
Drs. Moeti and Yao, Dr. Thakker, and Stephen Karingi, thank you very much indeed for joining us. And thanks to all of you for being on the line. Sorry if we haven't got to your questions. We hope you can come back and join us next week with some more encouraging news from across Africa. Thank you.